Polaris is based upon a number of genes involved in cell cycle regulation. And using this tool, we're able to further stratify patients, particularly African American patients, who have newly been diagnosed with prostate cancer. This restratification helps us to better select patients who are candidates for active surveillance or who require definitive treatment of their disease. We recently published this information in one of the high impact journals. We've also worked with another pharmaceutical company called Genomics in using their tool, and their tool is called Decipher. Decipher looks at a number of genes that are expressed in prostate cancer, and they use a grid. This grid has an expression profile of over 40,000 genes. So with this grid, we've been able to do a number of studies. One study, we've used this tool in patients who have undergone treatment of their prostate cancer, but we can also use it in patients who have newly been diagnosed with prostate cancer and have not undergone treatment. This tool helps us also to identify which treatment strategy may be best for the patient. We've learned a number of things, one of which is despite the fact that African Americans and non-African Americans can have a very similar clinical presentation, that the mechanism of their prostate cancer can be very, very different.